Hi everyone. Today in this video let us discuss oxybutynin. Oxybutynin is one of the anticholinergics and it is classified as muscarinic antagonist. This drug is available in its salt form oxybutynin chloride. It is used in the treatment of overactive bladders. In such people, few symptoms like urinary urgency, urinary incontinence, and increased urinary frequency can be observed. Oxybutynin acts as a bladder relaxant and it can relieve these symptoms. This drug can also be used in the children older than 6 years for the treatment of detrusor overactivity. Overstimulation of detrusor muscle may be associated with a few neurological disorders like spina bifida. Because of enhanced detrusor activity, children may have increased urinary frequency and urgency. Again, in such conditions, oxybutynin can be given. Here in this video, let's explore key facts about this medication, how it acts, what the precautions are, side effects, drug interactions, and how it is given. Please don't forget to subscribe to this channel and click the like button to support our work. Now let's see how this drug acts. Oxybutynin acts on the bladder as relaxant. On the bladder, muscarinic acetylcholine receptors like M3 receptors are located. These are the G protein coupled receptors, and when they are activated, they can produce bladder contraction. Normally, acetylcholine can bind to these M3 receptors, resulting in activation of phospholipase C system. These can cleave the phosphatidyl inositol biphosphate into two important components, IP3 inositol triphosphate and DAG, diacylglycerol. IP3 can increase intracellular calcium levels and diacylglycerol can increase the calcium inflow. When the calcium levels are raised within the cell, it can produce bladder contraction. Now, oxybutynin acts as a muscarinic receptor antagonist. It can block these M3 receptors, thereby preventing contraction of the bladder. So, it produces some antispasmodic action on the bladder, which relieves the symptoms of urinary urgency and urinary incontinence. Interestingly, oxybutynin is not acting on nicotinic acetylcholine receptors, so it is only having anti-muscarinic actions. Now let's discuss the precautions of oxybutynin. Oxybutynin can produce hypersensitive reactions and it can increase the risk of angioedema. This may result in swelling of face, lips, tongue and larynx. In case of swelling of tongue and larynx, it may lead to difficulty swallowing. In such conditions, oxybutynin should be discontinued. Any swelling in upper airway may lead to life-threatening complications. In such situations, this drug should be avoided. Oxybutynin can also produce few of the central side effects because of its anticholinergic action. Acetylcholine plays an important role within the CNS, and when its actions are blocked, it can produce significant anticholinergic actions. It can produce hallucinations, agitation, confusion, and somnolence. These side effects are particularly observed within the first few months of the treatment. That's why during these days, caution should be taken while driving vehicles or working with machinery. Acetylcholine plays an important role in the maintenance of memory, and anticholinergics like oxybutynin can reduce memory, resulting in dementia. So in the case of people who have pre-existing dementia, this oxybutynin should be carefully used. One of the roles of acetylcholine in the CNS is to control motor functions. When its levels are reduced, motor activities decline. So anticholinergics like oxybutynin can reduce motor activity, leading to Parkinson's disease-like symptoms. This may increase trouble with motor movements due to muscle rigidity. For people with pre-existing Parkinson's disease, this oxybutynin should be carefully used. Acetylcholine is also required for muscle contraction. In people with myasthenia gravis, muscle weakness can be observed. In such cases, use of oxybutynin can further increase the risk because of its anticholinergic actions. Acetylcholine is also required for gastrointestinal motility. Oxybutynin can reduce the GI motility and it can increase gastric retention. So for people with any pre-existing autonomic disorders or gastrointestinal obstructive disorders, this oxybutynin should be carefully used. Due to its anticholinergic actions, oxybutynin can produce urinary retention. So for people with any bladder outflow obstruction, the use of this medication may increase the risk. Since oxybutynin reduces GI motility, it should be carefully used in people with ulcerative colitis and intestinal disorders. Similarly, in people with gastroesophageal reflux disorder, GERD, this drug can increase the risk. A few of the drugs like bisphosphonates such as alendronate, risedronate are used for the treatment of osteoporosis. They can also increase gastric reflux, and when they are combined with oxybutynin, they can induce esophagitis, leading to inflammation of esophagus. So such type of drugs should be carefully combined with oxybutynin. Now let's see the adverse reactions to oxybutynin. Most of the side effects of oxybutynin are related to its anticholinergic actions. Since this drug is going to reduce glandular secretions, it can produce dry skin, dry mouth, dry eyes, dry throat, and nasal dryness. Similarly, it can produce blurred vision, urinary retention, and constipation. All these are commonly known as anticholinergic side effects. Apart from these side effects, it can produce a few of the central side effects like headache, somnolence, and dizziness. So these are the important side effects of oxybutynin. Where this drug should be avoided? Because of its anticholinergic actions, oxybutynin is contraindicated in a few conditions. For instance, in patients with urinary retention, gastric retention or obstruction, decreased GI motility, or uncontrolled narrow angle glaucoma, use of this drug is not recommended. In all such conditions, oxybutynin can further increase the symptoms. What are the drug interactions? Since oxybutynin produces dry mouth, constipation, somnolence, and urinary retention because of its anticholinergic actions, it should be carefully given with other drugs which again have similar side effects. For instance, we have antihistamines which are used for the treatment of colds and coughs. They are again producing anticholinergic actions, enhancing the side effects of oxybutynin. So such type of drug interaction should be avoided. Similarly, CNS depressants can also increase the somnolence when they are given with oxybutynin. Oxybutynin is metabolized by cytochrome P450 system. One of the drugs like ketoconazole is a strong inhibitor of CYP3A4 enzyme which may increase the levels of oxybutynin. This can lead to toxic effects of this medication. So in the case of potent CYP3A4 inhibitors, the dose of oxybutynin may be carefully adjusted. How it is given? Oxybutynin is available as a tablet. It is formulated as extended-release tablet, commonly denoted as XL. This formulation delivers the drug slowly for an extended period of time. Since this tablet is coated or layered to produce an extended release, it should not be crushed or chewed. It should be swallowed whole with a plain glass of water. Food does not have any interaction with oxybutynin, so it can be taken either with food or without food. What is the dose of oxybutynin? Oxybutynin is available in different strengths such as 5 mg, 10 mg, and 15 mg. Generally, the dose of oxybutynin depends on the patient's conditions and the severity of the symptoms. It can be started at a dose of 5 to 10 mg given once daily, but for a few people, the dose can also be increased at a weekly intervals with an increment of 5 mg. But the maximum dose is 30 mg per day. It is always better to take the tablet at the same time each day in order to produce a better therapeutic response. When this drug is indicated for children to treat detritus or overactivity, the initial dose is 5 mg given once daily. In children, the maximum dose is 20 mg per day. Beyond the 20 mg dose, it should not be given. So that's all about this medication, oxybutynin. It is an anticholinergic agent that acts as a bladder relaxant. It acts as an antagonist on muscarinic M3 receptors in the bladder, thereby causing bladder relaxation. This relieves the symptoms of overactive bladder such as urinary incontinence and urinary urgency. It can also be used in the children to treat detritus or overactivity. Oxybutynin should be carefully used in conditions like ulcerative colitis, reduced GI motility, Parkinson's disease, and myasthenia gravis. It can produce anticholinergic side effects like blurred vision, constipation, urinary retention, dry mouth, and dry eyes. It can also produce central side effects like dizziness, somnolence, and headaches. It can be started at a dose range of 5 to 10 mg, and the dose depends on the patient's conditions. So that's all about this medication. I hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.